Hey, let's talk quickly about what are some normal pee habits that you should be keeping in mind and that can sometimes bring up a little flag around if things are normal for you or not. Now, remember that normal is a spectrum, but on average, we should be peeing about 5 to 8 times a day, which means that we're peeing about every 2 to 4 hours. And what we don't want is that you're peeing every hour or less and that you're not feeling the sense to pee and it's been at least 4 hours. The second is when you're actually emptying your bladder, you are able to hold about 500 milliliters of water, urine, which is 2 cups. So when you're peeing, how long your pee should last is about 10 Mississippis, and it shouldn't feel like you're having to push it out. If you do, think about relaxing your pelvic floor to let things out of your body. The third thing is we should be able to receive information from our bladder. So when our bladder is almost stretched, so it usually sends a signal to your brain at about 75% stretched, it should be just kind of like a little memo to your brain saying, hey, brain, we're almost full. We've got a little bit of room to go, but just letting you know. And your brain is then able to send like an inhibition signal, it's called, or just a quieting signal. It's received the information, but we're at the grocery store, it's not the time to go, and you should be able to hold your pee for up to half an hour. So urgency is usually when that amount of time is really condensed, and the moment you get the information from your bladder, A, it's not a memo, it's more like yelling, and B, you're barely making it to the bathroom because you're just like squeezing to get there. So maybe the fourth thing to keep in mind is that you should be able to make it to the toilet without peeing your pants. The last thing I want to mention is also just about bowel habits. So we should be normal is anywhere between like 3 times a day to every 3 days. That one has like a lot more fluctuation because it's very digestive based and we're all really different with that. If any of these seem like you're way off the mark, come see a pelvic floor physio. We can definitely help to retrain your bladder and also work on any physical pieces that are contributing to leaking or urgency or difficulty to get pee out. Or anything else that you might be worried with. One last piece. Over the nighttime, you should ideally only be peeing like 0 times or 1 time a night. If you find that you're peeing more often than that, then I would reconsider or talk to a pelvic floor physio about how much liquid you're drinking before bed and how your quality of sleep is, how your pillow is. All these pieces can play into frequency, but your bladder can learn, okay?